We'll gladly get started with our afternoon session. But those of you who are here on time, ready to go, I appreciate it. We appreciate it. Our team is very looking forward to hearing from you and sharing with you some great information with Dr. Jackie Gray this afternoon. Shumanam, good afternoon. Hello, bonjour, and welcome to everybody who's joining us this afternoon for our session. And it's a collaborative session this afternoon. It's intended to assist in creating a crisis and recovery and resiliency team to serve your Native community. Today's a session to learn about and to see if this is a good fit for your community. We all know that we can use extra help along the way in our journey serving our Native people. And so today we'll hear from an expert in the field. And if you are still interested in learning more after today's session, you're welcome to apply for the training and join us in the journey to learning more about this pathway to crisis recovery and resiliency so that you will possess the knowledge to go into your own Native community as a facilitator. This is a collaborative effort, as I mentioned earlier. It's being brought to you by the National American Indian and Alaska Native Mental Health Technology Transfer Center, the MHTTC network, along with the Trauma Treatment and Service Adaptation Category 2 Center, along with the K-12 Supplemental Program. There are 3 offices from the University of Iowa that have collaborated for today's event, along with Dr. Jackie Gray. Although we're located at the University of Iowa, and we're a part of the national MHTTC network serving across the country, we actually have an opportunity to serve people all across the contiguous states up through Alaska, providing ongoing technical assistance and providing initiatives and projects. The National American Indian and Alaska Native Mental Health Technology Transfer Center is supported by a grant from SAMHSA. The content of this event is the creation of the presenter, and the opinions expressed do not necessarily reflect the views or policies of our office, SAMHSA, HHS. At the end of today's session, we'll have a few links going out to you for your email. One will be a link to today's presentation specifically, giving you information, seeing the slides once more, as well as listening to the recording. For those of you who are interested, there will be information given out on how to request and receive CEUs, as well as certificates of attendance where it's applicable. And those CEUs are offered by the NADAC office. In addition to that, in the chat box, I'm going to provide a link to our evaluation survey, which is really important to us. When we have the survey, we know that when the surveys are completed, rather, and we get the information from you all as participants, we know how we can share this information with our funders so that we can continue to provide opportunities like this for you in the future. Your participation is greatly appreciated by completing the survey. There may be some questions you don't want to answer, and that's okay, you can skip them. Please know that your responses are kept confidential, and so they will not be directly linked to you. If you have questions about the survey, you're welcome to ask myself or any one of our team members. Although we're gathered here virtually today, it's really important to know that we acknowledge the land and pay respect to the Indigenous nations whose homelands were forcibly taken over and inhabited. Here before you, I'd like you to read for a few moments in silence the land acknowledgement that was created by 3 of our team members, Ella Driscoll, Keely Driscoll, and Sean Bear. Before I begin sharing who our team is, a little bit more about our center, I'd like to invite a participant today to please share some words of wisdom, a prayer, a song, so that we can start our session out in a good way. Creator, we come before you with open and humble hearts, thanking you for this opportunity to learn from Dr. Gray. We thank you for the words that she'll impart to us, for the information, the wisdom, the guidance she'll give each of us as we look to providing a pathway to each of our communities to address the crises that we've been facing, to address how we recover from a crisis and how we can continue to be resilient people. We thank you for this opportunity for the team to come together to provide such an opportunity. And we thank you for all the participants who are here with us today. In this we pray. This is a group effort. We have several people on our team who put this together along with our presenter. We have our co-director for the K-12 program and the Trauma TSA, Teresa Brewington. She's a member of the Kohari tribe and a descendant of the Lumbee tribe. She holds 2 master's degrees and is currently pursuing her PhD. She's held various positions in education as a director for several mental health agencies, a school guidance counselor, and even a principal. She currently resides in the Meskwaki settlement with her husband and her granddaughter in Iowa. Megan Dodson is our program manager for the National American Indian Alaska Native MHTTC. She earned her degree at the University of Iowa, majoring in sociology and minoring in community corrections and criminal justice. She's worked on several programs throughout her 19 years with the University of Iowa. I'm Dr. Allison Bayes, and I serve as the K-12 program manager. I'm a member of the Tapilam Kwabetekan Nation back in South Texas, and my expertise spans through K-12 and higher ed settings. A lot of my research is among Native populations, where I look at best practices from a Native cultural lens with services across Indian country, which are intended to strengthen and empower individuals, their families, as well as communities. We have 6 students, graduate assistants, who serve in our office also. All of them are pursuing higher ed degrees in mental health. And our presenter. Dr. Jackie Gray is a Choctaw Cherokee descendant and Professor Emerita at the University of North Dakota School of Medicine and Health Sciences. She is the director of the National Indigenous Elder Justice Initiative. It was funded since the fall of 2011 to address the issues of elder abuse in Indian country. Dr. Gray is the chair of the psychosocial work group of the Strong Heart Study, where she developed the crisis and resiliency team model also at the Creek County Health Department in Oklahoma. Dr. Gray has worked addressing health, mental health, crisis intervention, and health disparities across Indian country, and internationally working with the Maori suicide prevention. She has worked with tribes across the US for over 30 years. She received her doctorate from Oklahoma State University in 1998 and has been at the University of North Dakota since 1999. At the end of her presentation, at the end of this webinar, you'll be given more information about how you apply to be accepted into this program, and we'll be able to answer some of your questions, the time commitment, and the logistics for how we'll be promoting this program for the course of the next several months. And so now I turn it over to Dr. Jackie Gray.
Dr. Bayes. So thinking about what we were going to talk today, what is a crisis? Has anybody ever experienced a crisis? Has anybody only experienced one crisis? Because chances are you've had multiple over the course of your life. So if we can go on to the next slide. So looking at the dictionary, again, a crisis is defined as a stage in a sequence of events at which the trend of all future events, especially whether it's for better or for worse, is determined. In other words, a turning point. It's a condition of instability, of danger, as in social, economic, political, or international affairs that lead to a decisive change. So what I'd like you to do now is, what kinds of things, based on this definition, would you consider to be a crisis? And you can enter those into the chat. COVID in Ukraine, okay. Other things that people can think of that would be a crisis, whether it's a personal crisis, death, fire, earthquake, flooding, good, inflation, okay, illness, tornadoes, food shortage, unemployment, vicarious trauma, good ones, domestic violence, a spouse's worsening illness, housing, the dead babies at the boarding schools, crime, homelessness, death, sexual assault. Okay, let's go to the next slide. You have come up with a really good basic list. So some of the types of crises that I came up with were accidental death, abduction, chemical spills, earthquakes, escaped criminals in your area, fatal auto accident, fire, blood, a gun at school, homicide, house fires, hurricanes, pandemics, rape, suicide, a teacher's death, tornado, tsunami, wildfires. I think we've heard of almost all of those things occurring even in just the past year. So when we think in terms of all of these different crises that impact our lives, how do we deal with those crises? What resources are there, especially at the community level, maybe at the school level, maybe at the tribal level? What resources are there to help deal with all of those? So that's what we're going to talk about as far as looking at crisis today. Next slide, please. So why do we need a crisis recovery and resilience team? Well, when we think in terms of, well, I'll use an example just from here in Oklahoma where I am now. Just last week, there were 6 young girls killed in a car accident while they were out on a lunch break from school. Their car was hit by a semi-trailer and all 6 were killed. That has a dramatic impact on a small community. When you look at how many other lives that those 6 students touch. So when you come back into the school, those teachers, those administrators, all of those people that work with the youth are also impacted by that crisis. So they may have other things in their lives that particular crisis will trigger. And that is why it helps to have some backup. Excuse me, my throat was going. Sometimes it helps to have expertise when you're in the trenches and dealing with that. Support that can step in for those teachers or administrators or other staff. Someone with some confidence of how you go about addressing all of those situations, what kinds of expertise you may need to deal with a particular situation. I know shortly after we started our crisis team in Oklahoma, we had a 9-year-old that went home to play for that Thanksgiving break, and he was out. He grabbed a handful of crackers as he went through the kitchen and out in the backyard to play on the rope swing. And for some reason, he aspirated those crackers and he got tangled up in the rope swing and hung himself to death. A lot of people were impacted and didn't really know what to do as far as dealing with death with young children. And how do you address that? and the rumors that are going around, and how do you address rumors with children and those types of things. So bringing in other people that had expertise in those areas were important in helping to address those things in the classroom. And then being able to debrief with all of those impacted locally to kind of help them process what all happened, how things might need to be handled differently in the future, what kinds of things might they want to put in place. Next slide, please. Another reason for a crisis and recovery and resilience team are to have resources. If you have a local team, they know those local resources. When we first developed the program out of Creek County, one of the reasons we did was that there had been a death in the community, and a crisis team from one of the hospitals in Tulsa had come out to help with that. But they were there for 3 days. They didn't know the resources. And at the end of the 3 days, they went back and we didn't hear any more from them. Well, we felt like we needed resources that would be there, that knew what the local resources were, would be able to follow up with those that were impacted following that 3 days that might need things. Another thing that happened with another death in the community was that it happened on a Friday night before a football game, that a young man was shot to death. And when they asked for this crisis team to come out from the hospital on Monday, they said, no, it had been too long. They only responded immediately after a crisis. 3 days after, they didn't come. So we knew that coming back into school on Monday morning, there were going to be a lot of things that needed to be dealt with. And so we needed to have someone in place to help address that. Also, our local resources are more available because we're there and impacted by those crises. And it's important to acknowledge and utilize that local expertise and say, okay, here are people in our community that you can go to, and it doesn't have to be this crisis. It can be anything else, and you can still go to those people. And people that are available for that follow-up, like I said, whether it's counseling, whether it's workshops and in-service training for staff, whether it's other types of support that may be needed. Next slide, please. The third reason that you might want a crisis recovery and resilience team is the lack of resources we have in rural and tribal areas. That our individual communities, we don't have a lot of mental health professionals. We don't have people that are trained to deal in communications and deal with the media, because whenever something happens, the media comes in swarms, wanting interviews and wanting to, cover the story. We may not have hospitals or clinic services available, especially on weekends and evenings. And there may be few programs that are available to support the youth in dealing with all of those situations. So when you have a crisis and emergency needs, things need to be available that may not be available on a routine basis. In this case, it may be pulling from teachers, mental health professionals, people to help with communications, healthcare providers from other communities that can come in and help during your time of crisis, knowing that if they have a crisis, you would be able to return the favor to their community if needed. So I'm seeing a number of other crisis situations and tragedies that are being listed in the chat. And it's bringing those resources together in an organized way, not just a bunch of people showing up, but having some organization to it so that people know, if you see a reporter coming across the parking lot, who's going to take care of getting hold of that person and taking them to whoever is making any statements to deal with the crisis. Because if you leave them just to wander around, they'll grab a student or someone else just to get a soundbite for their broadcast. So in some cases, although the students might speak to that, we want to make sure that as far as official statements, they're getting to that person who's authorized to give those official statements. As far as other needs, we know, we want to know that there are people that students can be handed off to deal with situations. I know when we first started our team in Creek County, we had our training on a Wednesday, and on Saturday afternoon, there was a car accident where 3 cheerleaders were killed. Their car, it had been raining, and the car hydroplaned across the highway and hit another vehicle head on. And so when we called people about coming out for the crisis team to meet at the school on Monday and everything like that, people's response was, well, this is a drill, right? This has to be practice. It couldn't happen that quick after we had just gotten things organized. But, they knew what to be done. I was walking through the school that Monday, and with one of the counselors, we were going to take care of something that needed taken care of. And we saw a reporter coming through the side door, and we just looked at one another and automatically knew who was going to go take care of the reporter and who was going to continue to do the task that we were heading to do initially. So really having those things worked out so people know who's going to handle what. All right, let's go to the next slide, please. So, talked about what a crisis is. Pardon me? Oh, I thought someone asked something. So what is a crisis and resilience team? Well, it's a group of people that are trained to facilitate and mobilize resources in an emergency situation, to help stabilize and recover from a trauma, and better deal with future emergencies. So part of that is taking what you learn in that crisis and being able to apply it to other crisis situations. So in a crisis situation, those decisions need to be made wisely, appropriately, and with dispatch. There's a high level of emotionality that can get in the way of the process. And too often, a fear of overreacting, a fear that parents will bring legal action, and other types of things like that prevent people from making wise and quick decisions. Yet, just as we encourage students not to ignore or dismiss a potential crisis, we must also, as adults, practice the same precautions and be able to address that crisis. Next slide, please. So the first steps in crisis intervention are making people aware the problem is serious. Something major has happened. People do have the skills to help. Everybody may not have the same skills or all of the skills, but they have something, even if it's a matter of answering phones, collecting information, dealing with rumor control, passing the Kleenex, whatever it is. You may not be the counselor, but there may be a lot of other things that you can do to go in and sit in a classroom so that that teacher can go and deal with their grieving process. Helping to clear out a locker, things like that. There's all kinds of skills that are necessary to help in a time of crisis. There's a support system, knowing that there are referrals. We would have a whole sheet of referrals and information that could be provided to people. We developed a list of emergency phone numbers and it was a long list. And it was where it would fold up like a credit card, and they could carry it in their wallet. So, and we gave that out to all of the youth. And it had police, fire, sheriff's office, hospitals, mental health, health department, all the school numbers, all of those things on this one piece of paper that they could carry with them. So knowing what those resources are and how to get in touch with them, that is protecting and it helps them. And then who's available long-term in the community, in the school, in the tribe? Who is it that's still going to be there and be someone that they can go to over the long term? Those are some of the things that people need to be aware of when they're dealing with a crisis immediately. Next slide, please. And then local resources for that support system. So expert consultation. Those people that know what kinds of things you should and shouldn't do. You know, why after a student death, you don't have an assembly. You keep the students in small groups. You know, the tendency for most schools is we pull everybody together and we have an assembly. But that isn't the best way to handle it in a crisis, because you have that emotional contagion effect that just escalates the emotions when you pull them together in a large group. So keeping them in smaller groups and addressing their questions that way. What's needed in terms of support personnel? How many counselors do we need to bring in? How many people from other places, teachers, others, do we need to bring in for that support? It helps to know, you know, how much, you know, how many school buildings, how many school facilities are we covering? What other schools might be impacted in our community? Do we address things by clan? Do we address them in chapter houses, in the Chickie? Do we address them in other cultural settings where people tend to gather? And who tends to address those? Who do you need to go through? Do you need to go through the clan mother? Do you need to be pulled in by certain members of the community for it to be acceptable for people to make use of the resources you offer? And how available are those experts? I know there's been several situations that I was called out when I was in North Dakota. Shootings and other types of situations that happened around holidays. And maybe the state and other groups would provide someone to come in the first day And then they were all off because it was a holiday the next day. So nobody came. And I ended up being the only one there because I didn't take the holiday off. I stayed because there was a crisis and there was a need. Sometimes when you're relying on government employees that, you know, have a regular work schedule, they aren't necessarily there other than certain days and certain hours. So you have to understand how are you going to handle that at other times if those experts that you need aren't available all that time. And that availability of extra help as the community begins to recover, to help do some planning and ways to make this a positive situation from that crisis. You know, a crisis can turn either to the negative or to the positive. And we wanted to turn toward the positive. So what are lessons learned from that crisis and things that you want to change? I know that once we started our crisis team in Oklahoma, the first time, you know, the youth at the school were like, oh, where do we go? What do we do? And we had to kind of guide them. The second time they knew where to go. They knew how we'd set it up the first time and they did that. The second time they said, well, why didn't we have this before when there was another situation? They wanted, and so explaining to them that that crisis team partially came out of that other situation, that we decided that there were things that we needed that we didn't have before. And so the reason we have it now is because we didn't have it in that previous situation. So being able to explain some of those things and help them to see that this is a way that we make things better, or we try to make things better out of that crisis or tragedy. Okay, next slide, please. So how does it work? In this slide, it's going to need a lot of clicking, Dr. Bayes. If you want to just go ahead and start doing that. Well, first there's a crisis. And as a crisis occurs, the next one, it impacts the organization. And let's use a school as an example. So the school becomes aware that they've had a death of a student, a teacher, a staff member. And so they're trying to figure out, what do we do now? Well, they start their initial response. That's one of the things that happens. Next, they may contact the crisis recovery and resilience team coordinator to talk about what the needs may be. And they also may contact other resources that may be around. Next. So then the crisis coordinator contacts the team members or a number of team members to meet whatever they feel like the need will be in that situation. They may not call out the whole team. They may only call out a few members. Next. And all of those are interacting as far as the response. So from that response, there's debriefing. And that debriefing comes back around next to where we evaluate and adjust what we do. One of the things that we realized after the first time we were called out is there were a lot of things that we needed that we didn't have. We didn't have pads and pencils to take notes and send notes and things like that. We didn't have boxes of Kleenex. Well, you know how the government Kleenex is? We didn't have soft Kleenex. We just had the rough tissue that you get out of government places. We didn't have a flip chart and markers. So we made a list of all those things that we needed that we didn't have. And then we put together our go bag. That was a bag that was packed for a crisis that we just kept in our workroom, our storage room, so that if we got called out, someone would just go by and grab that and get it in their car and take it with them in order to have it, those materials there when we responded. And so our follow-up training to that we did was who brings we called it who brings the Kleenex as far as the response to that crisis. We also realized that, there were other people in the community that wanted to be part of helping, including the Ministerial Alliance, the foster parents, because if any kids were going to be triggered, it was going to be those foster kids. We thought about all of those others within the community that were willing to be a part of that, even if it was just sitting with a student, that they could do that. So once we evaluate and adjust, we go back into our crisis response and resilience team, and we do more training, and we talk about it, and that will go into the next response. So I'm not great with the graphics, but this was the best I could do with trying to put together a kind of a flow chart of how everything worked. All right, next slide, please. So what are the roles that we need to fill when we have a crisis team? Well, first of all, a leader, someone that's going to help to keep things organized and moving, which is usually your crisis coordinator. Also a resource coordinator, someone that's going to keep in touch and know what the resources are and any new people that have come to work in the community and other information, and keeping people informed and up to date on what's happening with the team. Media liaison or communications coordinator. I know I responded to one shooting and it was around a holiday, and as I said, everybody else had left. And so as I was going to talk with some of the staff at the tribal headquarters about what was going on, I met with their communications coordinator for the tribe. And she started referring all the reporters to me. And I'm like, one, I can't speak for the tribe. I'm not a member of the tribe. I'm not from here. I haven't been authorized to speak for the tribe. Two, I can't answer any questions about who was involved or anything like that. The only thing I'm willing to provide to the media are the kinds of symptoms people need to look at to recognize that a friend or family member may be in crisis and where you need to go to get help. Those are the things that I would talk with them about as far as an article. So you need to also have someone that knows what parameters they need to work within, because if you have someone that just will go out and address anything, it can cause a lot more problems than it can help. And then support people, knowing where they're needed and how they're needed. Just someone to answer phones and gather information, getting messages to different people so that they can respond, and dealing with rumor control, making sure that any information that we're giving out, whether it's to parents or anyone else, is based in fact, that we're not, that we're shutting down any rumors that are developing. One accident that we responded, I actually got the phone call before the police even got there from a friend of mine who had driven by the car accident, and she called me up and said, Jackie, I just wanted you to know the crisis team will probably be called out. There was an accident And she told me where it was and that it involved teenagers. Well, it turns out that the media got word that, well, before the media even got word about it, the students were talking about there were squirt guns involved, and they were shooting squirt guns or pellet guns or something at this other car, and that's why there was an accident. And then there was this whole thing about they had a chart up at a convenience store of who was shooting who with squirt guns and taking out the other team and things like this, and it was a competition. And that's what resulted in the accident. So we had to deal with all kinds of rumors that were going on in order to manage the situation and, not have riots occurring, basically. Another thing is crowd control. I responded to Red Lake after the shootings there. And in the times that we were talking with staff, one of the things, not only did they have staff doing things that they didn't normally do, like housekeeping was having to, clean up bodies that were covered in blood. But you had all of this crowd of parents coming, and they didn't want them in the hospital because it was chaotic enough inside the hospital. They kept everybody outside. So it was managing that crowd. And then along with that was, how did they identify all these kids that had been shot? And so they had staff members that were going out and asking parents, what were your kids wearing to school? What kind of shirt did they have on? What kind of pants did they have on? What kind of shoes did they have? Most of the parents could not answer what kind of shirt or pants their child wore, but they could identify their shoes. So that's how most were identified, was by their shoes. But somebody has to take that information, and you're dealing with crazy parents wanting to know, is it my kid? Are they alive? Are they not? What's going on? And you're trying to get information so you can help as far as the treatment. Having counselors and any mental health professionals that may be in the community or that you may need to bring in available is always important. In some situations, you may need a mediator. Sometimes there can be all kinds of emotions erupting into violence and anger and things like that that may need to be dealt with. So mediation, someone to help intervene in those situations. Have different interventions that help in working with those groups of youth at all, even following. So there are a lot of different roles. These are just a few of them that might need to be filled by a crisis team. Next slide. So what would we expect of team members? Well, first of all, they have to be willing. And then they'll need to have training. And it's pretty basic training on, what you need to be able to do, recognizing some of those things like I talk about as far as knowing, where are you going to be able to send people and things like this in different situations, who the resources are and how you get people there. So getting that training and how your team's going to work. Initially being able to assist in developing the structure. How is our team going to work? I showed you a general flow structure, but each community, depending on the resources you have and how you're going to make use of it, will develop a little different structure. Are you going to meet at the schools? Are you going to meet in the chickie or the chapter houses in your district? Are you going to meet as clans? How how is it best for people to meet to address the crisis? And then you need to practice whatever that procedure is. Whether it's using a tabletop where you're given a scenario and then you go through who's going to do what and how you plan it out, or if you actually go through an advanced type of thing. And I know sometimes like emergency management does these with maybe a school bus accident, that they fix the kids up with makeup and all for injuries, and they go through the process and they have the road closed and all of these things going on. And you actually go through the whole thing to see what's happening and what's needed. One thing I will say as far as practicing things that way, I know one that we did that had a school bus type of incident. The big mistake they made was not de-rolling the kids afterward, as far as helping to bring them back into who they were and that they were students in the school and things like that, because they were bouncing all over the place the rest of the day. And the teachers, they finally just had to let out school because they were just so out of control, because they didn't bring them back out of those roles that they were playing. Another responsibility as far as the team is just to meet periodically so you can go over those things and kind of refresh those memories as to what the process is and how do we work. And you have to be willing to respond when you're called. That doesn't mean that you can't ever say no. It just means that if at all possible, you need to be available when there's a crisis and be able to respond. And when we developed the team initially, one of the things that we focused on was the marketing aspect, assist in promoting the team. That it doesn't do a bit of good if we have this team all organized and everything and nobody knows we exist. So letting people in the community know, talking about what the team is and how it responds, you know, being on the radio, talking to groups, things like this, to let people in the community know that the team exists and what it's for. Okay. Next slide, please. So how much time is going to be required of a person? Well, you'll need the time for training. We had initially a 2-day training, and then we did a 1-day training like twice a year after that. We had subcommittees, one that kind of set up what the procedure was, put together, you know, kind of the requirements, what people were agreeing to and all of this, how it would function, who, you know, what was the calling tree and that whole process. As I mentioned just a few minutes ago, the marketing, how we get the word out about the team, and then other types of committees that may come up that were needed. Maybe it's recruiting to get people that want to be a part of the team that are, or maybe it's screening, you know, going through who's going to be part of the team. I know when I responded at Red Lake, one of the things that they really cracked down on was everything had to go through the care team that operated, you know, at the main building at the hospital, because they had discovered some child molesters that had gotten in and were putting themselves out as counselors going around in housing areas looking for kids. And so, you know, really trying to control for those things. So, you know, if you've ever, the things you least think of, those are the things that are going to happen. And so coming up with how you're going to handle those situations if they do happen. And then attending the meetings for updates and more information, new resources, you know, others that are part of it, how things are going to be handled. Next slide, please. Where do you go from here? Well, the first question is, do you want to follow this path? Is a crisis recovery and resilience team something you'd like to develop in your community? And if it is, then we have something for you at the end of this today. So stay tuned. But the thing about this plan is it's different for every community. And we'll work with you in helping you come up with a way that works best for your community if this is something you think would fit. You'll need to form some type of procedure or subgroup that you're working with that could meet with us, and we kind of talk about how you go about doing that development of the team. You'll need to collect information, identify resources, whether it's people or materials that you have in your community and there may be in surrounding communities. And then planning and scheduling a training to train the people that are on the team for how you're going to handle things. And if it's a marketing subcommittee or a way to get the word out, as far as that you have this team in place. And then you set up and you invite people to come to the training. So that's kind of the process that we'll go through as far as helping you develop this. And then we would meet with people on like a monthly basis following that to answer questions and provide technical assistance and helping to work out the rough spots in putting your team together. Next slide. So here are some important links that can also provide a lot of information. The National Child Trauma Stress Network, Crisis Preparedness, Response and Recovery Resource Center, the American Academy of Experts in Traumatic Stress, and the SAMHSA Disaster Technical Assistance Center all have a lot of great information. I know one of the things when we went out on different calls was it was always, okay, we need information. How do we get something out? So people would be spending time doing searches on the web, trying to find resources that could be printed out and handed out to people. Things like that we could utilize. So all of these are great resources for that. Next slide, please. So now, what are we talking about? You want to take this?
I will let you go ahead and start, and then I'll pull up the application. It's on the screen.
What we are offering is an opportunity to apply to work with us to develop a, you want to back it up? Yeah, thank you. A crisis recovery and resilience team in your community. So we have a short application, I think it's just a couple of pages, that will be due on April 29th. And then we'll do a video interview with those that submit the paper application to kind of talk about, you know, what you're thinking in terms of a team for your community and what your community's like and the resources and things like that. And then we will select 3 teams where the program will be implemented. You know, we've had in the past an urban program that we worked with. We had a tribal program that had multiple sites that they needed to develop something in. So, you know, things are different with each different type of situation. So, you know, we're not expecting any of those three to look alike. What we're offering, there will be at least 6 learning collaborative opportunities or video conferencing sessions where we will work with you as far as identifying your stakeholders, identifying the kinds of traumas that affect your community, cultural considerations that you need to keep in mind, the community engagement opportunities. How do you get the word out to people and invite those people that in your community that would be key to having something like this succeed? And how do you utilize media in your community? So we'll talk through a lot of those things. We'll help problem solve with you and things like that during those video conferences. And we'll use your application and your goals in that application in helping to frame a lot of what we go over in those video conferences. So today is the initial session where we introduce it to you. Once we identify the three groups that we'll be working with, we'll have a follow-up session in May to get all of that set up. And then there'll be 5 monthly sessions from June through December where we do that technical assistance and working with you in helping to refine your team. And then there'll be individual community follow-up meetings in the spring of 2023. So we're really looking at May of 2022 to March of 2023 would be the time commitment working with us. But it will be up to you and your community to sustain this type of program. And one of the reasons that it's really sustainable in communities is there really isn't a lot of financial commitment to it. It's working with what you have and those you have in your community to make things work. Okay, Dr. Bayes.
So what we have here for you on the screen, you can.
So you'll have to stop sharing and then start sharing again, or, oh, okay, there it is.
Okay, this is the application that will be sent to y'all, as Megan Dodson pointed out. Everybody who's participating in today's event will be given access to the recorded version of today's session with Dr. Gray. In addition to that, you'll have the hyperlink that takes you directly to this application for the Crisis and Resiliency training. It requires some personal information. How we can contact you is really important. Your tribal affiliation, because we want to know which tribes are wanting this kind of team to be created within their communities. And if you work for a specific organization within that tribe, please let us know who it is. And then there are a few other questions about how you will be utilizing this, who are the stakeholders in your community, and any other pertinent information that'll help us in determining the first 3 groups, communities that will be a part of this project. I don't recall if Dr. Gray shared this, but we had a pilot study of this exact same training a few years ago through our center. And so this is the second run that we're going to be offering. And in looking at the chat and in hearing some of the responses from people via email, reading some of your responses, it seems like there are a lot of you who have quite an interest. And we want to be able to honor that and respect that and encourage you to be a part of this training. But because of our limitations, we're going to do a group with this first go through, after we go through the applications in May. Once those 3 communities are selected, then perhaps we will do another round later on in the following year, kind of like what we're doing right now, where it'll be a good 9-month commitment from everybody who's participating. So keep that in mind. Anybody can apply for this. You can do it as an educator. You can do this as a mental health professional. You can do this as a tribal leader, someone who has the heart and the interest to create this kind of crisis recovery and resiliency team in your community. You're going to need some support, as Dr. Gray pointed out. You're going to need some, be able to identify some people in your community who could be a part of the team. So that's very key. Keep that in mind. It's really important. But everything that we've shared with you today will be sent out via email. In addition to that, what I want to do is ask Dr. Gray to address a few questions that came up in the chat. The first one I remember reading was, is mental health first aid training a part of this?
Something that I suggest to teams that would be a good training for the general crisis team, because it is very generic and it covers a lot of different issues and kind of how to respond to that. So it would be a good basic training. I think in addition to that, there should be some things around the culture for the tribe, especially if you have some non-tribal members as part of that crisis team. Or if you have non-Indians as part of that crisis team, then it would be good to have that as far as the culture and how the culture works. But yeah, I think mental health first aid could be a good basis for the training. I'm not sure if that's available yet. Teresa, is that available yet?
Which one?
Mental health first aid?
It's not culturally adapted, but it is available and we can train on it.
Okay, I know there's some other groups that have.
And there's spurts.
That do the training, but we are trying to get it culturally adapted so that it would be available through the National Center.
Yeah, we're actually looking right now at other resources too, besides mental health first aid, just so you're aware too, Jackie, and I'll update you on that.
Yeah, I like mental health first aid, like I said, because it's more generic rather than like assist in some of the suicide prevention trainings.
Yeah.
I think it gives you a lot broader skills as far as dealing with various crisis situations than what just focusing on suicide, because there are a lot of other aspects to it than suicide.
I have a couple of questions for you, and I'm just looking through the chat too, if that's okay. So this is not just for schools, this is for the community. Or would you do a separate one for, go ahead.
I used a lot of school examples because in a lot of communities, the school is the center.
Yes.
And so that's where you really have the greatest impact is with the school. Yep. But within the schools, with the churches, with the, as I said, chapter houses, districts, however it works for your tribe, as far as the best way to make it a part, that's how you need to do it.
Along with that question, Dr. Gray, for the schools or communities, thank you for answering that. Someone asked earlier in the chat, does this include agreements like MOUs with local police, EMS, schools? How does that work?
And we never were that formal. We kind of just talked with, we called ours a volunteer crisis assistance team because we weren't requiring anyone to be a part of it. But all of our service providers in our area recognize the benefit of their staff being a part of it. And so, you know, they made verbal agreements and sent their staff to the trainings. If there's a need to have more formal MOUs, those could be done. It just depends on the community and
the situation.
Yeah.
Yeah.
Along with that, Dr. Gray, someone else asked in the chat, do you know if there are other programs similar to this? The
Well,
others
I
come back.
know after we developed the program in Creek County, within a year, it was required by the state that every county have a team like this as part of their emergency management. Because most of the emergency management before that did not have a mental health component. And our emergency management person in Creek County asked if she could use our team as the mental health component for their county emergency management. And so we were part of that. But then, like I said, it was required in every county after that. There have been other teams with, I've worked with different groups with several tribes. I've worked with different school districts and places around the country. And so there are a few of these, but we've been offering it through the National Center, just focusing on tribes.
Thank you.
I have another question, Dr. Gray. So there's, sorry, my dogs are barking. Okay, so there's two situations that I'm sitting here thinking about with this. One is that a lot of times when, I'm going to give an example, a youth goes into the hospital on suicide watch, 3 days, they send them home, or 24 hours is really what Medicaid is for. And then they send them home. A lot of times there's no follow-up, or they'll rely on the patient to follow up with that care. And we see that a lot. Is what you're offering include something like that follow-up and that community, I guess, connectiveness to make sure that that child is getting all the resources put together in place to help her or him?
If that's something that community sees as
As
a
a
need
need.
that they have,
Mm-hmm. Yep.
then that part could be built into it.
Okay.
Whether it's through a shelter or whether it's kind of through a, we'll have someone available around the clock to sit and talk with them type of thing over a certain amount of time, or, there are different ways to do things like that depending on what the need is.
Yep.
And I know for some tribes, the youth end up being sent all the way across the state. And so they really don't link them up very well back in the home community as far as follow-up.
Yep.
And so, it's a matter of making this something then that's workable and that you have people in the community committed to.
Yes. And another thing I wanted to say is, ironically, when I worked at a public school, we had something like this in place. But when I was a principal at a tribal control school, we didn't have anything in place. And it's really important that when we do have a crisis, we do have a response and that we're proactive in that response versus reactive in that response. So what I'm hearing is your program, what you're offering, is how the community can come together and have those available resources ready and available in case a crisis occurs, correct?
And, you may think when we first started putting together, we were thinking in terms of suicide.
But it could be anything.
But the first thing that happened was a car accident.
Yeah.
And the other thing is we were responding as far as the 3 cheerleaders that were killed. But what came out that day at the school is we had one girl in junior high pull us aside and that she needed to talk to someone because it was her dad driving the truck that hit them. And she didn't feel like she could say anything about it to anybody because everybody was grieving the girls.
Yep.
So, it's never what you think it's going to be. So having something that's flexible enough that it's going to work in any situation or almost any situation. Okay.
Thank you.
And that's why we say it's different for every community, because it is. And yet it's flexible enough that it can work in different situations. Other questions?
Yes, another one's in the chat, Dr. Gray. It says, with the previous pilot programs, how are they doing with the implementation of this?
I know one was able to tie in with telemental health and made that available for people that were working there. I know I've had some follow-up from another one that they're ready to do some additional organization with it than where we left things. And so they've been in touch with me about that. So, you know, it's not like it's over with when your meetings with us are done. That continues to evolve as you become more aware of needs in your community and how it can work with that.
Thank you.
I think I saw a question in the chat asking about half the tribes in California and if they were eligible. I think that would be a major challenge to deal with that many tribes, but maybe selecting a small group that that could work with, that would be in close proximity, that could work together, might be a possibility.
And we're looking forward to you all submitting your applications and asking questions. And we know we're only here for a short time right now, but you're always welcome to follow up with more comments, questions, concerns regarding today's event. I have my email address here for those of you who may think of a question or two later on down the line after you've sat home and processed more about this. But we also want to make sure that you're able to help us understand your needs better. There's a QR code here listed for the survey, and I also put it in the chat box. So please make sure you take time to do that. And if you know Teresa Brewington or Megan Dodson because of the programs that they oversee, you're welcome to email them as well. This was a team effort. And so Dr. Gray has decided to join us once again in leading this effort, this important work that needs to be done across Indian country. We know that pandemic was just one crisis, but we know our communities have others that have occurred. You heard the stories, you know the stories. Some of you have lived through the stories. So we want to make sure that, you know, we have, you have our support in addressing them. You have our support in training for them. It's going to take some commitment on your part. We're glad that you participated in today's event, but if you are serious and want to create this team within your community, please reach out to anyone on our team. Take the time to go to the application. And I think I'm going to try and put it back in the text, in the chat, if I can get it. And I don't think I can. But it will be emailed to you. And it is going to be posted on our website for those who are interested. But it will be emailed to all the participants from today's event. So if you have questions, comments, concerns, if you want to fill out the application and let us have time to review them, we're going to give ourselves about 3 weeks or so to field all the applications, read through them, and discuss with Dr. Gray or how we move forward with the applicants so that we can make a decision.
Real quick, I don't want to interrupt you, but Carolyn is I think you answered it, Jackie. But Carolyn, I think, is answering the same question, asking the same question about the success of your previous work in this project. She said that she missed it.
The previous pilots, I believe the things are still going on. I know that one of them, we connected them to some additional mental health resources through telemental health that they didn't have available to them, which was in an urban center. And then the other multi-site tribe that we worked with, I've had continuing interaction with some of the tribal members there, and they're continuing to evolve as far as their program.
I was able to figure out the application link and it's there in the chat box. But again, all this will be emailed to you after today's event for all the participants who are interested in actually applying to be a part of the training, the ongoing training, so that you can create your own crisis recovery and resiliency team.
Gidget, if you're out there, as long as you registered with that address, you will automatically be getting the information. If you did not, we could always save the chat and make sure that you get the information to your email.
Are there any further comments or questions?
Gidget may want to respond really quick. I think she was trying to.
And the link that's in the chat also takes you to that application. So if you want to just get that link, it can get you there as well. Other last minute questions?
Hi, this is
Madonna.
Madonna. Hi.
Go ahead.
Yes.
So someone had said about predators like pretending to be counselors. How do you recommend stopping that if I'm to be a part of a team? And I'm in Northern California, Sonoma County. So I serve where I work. I serve Napa, Sonoma Lake, and Mendocino. I'm also native as well. So I am very interested because I work with youth.
Is anyone that went out to meet, you know, whether it was to a school, to one of the district houses or anything like that, or to meet with youth anywhere, they went out in teams and they were matched at, and they had to be licensed. And we really did a whole lot with dealing with the credentialing, because there were so many people coming in because of the rotations and all from the feds that came in there at Red Lake. But we also had people, like I was there from UND, there were others from UND, there were other people from all over. So we matched up with one of the feds that was a part of their crisis response, as we went out to different sites and did different groups and met with different programs. So that was one of the ways that we helped to control that. And we also put out on the radio that there would not be any individuals going out and knocking on people's doors and saying they were counselors that were authorized by the tribe to do that, so that people were aware that nobody was going to be doing that. They would have to go to one of these locations, and the people there, then there would be at least 2 people there to deal with it. But it was something we had to deal with right, you know, in the midst of it, because it hadn't occurred to us we were going to have predators coming in and taking advantage of the situation. But, you know, yes, Teresa, you're
Other question. Sorry, guys. I just got puppies. Okay, so because we have different crisis situations going on, for example, what I was telling you about, one of our youth got mauled by a pack of dogs yesterday. That is obviously a crisis. The plan that you're creating, is it going to be generic enough so that they could use that plan for other situations as they come up?
Yes.
Okay.
Yes. And, you know, I remember, you know, working with someone in one of the elders programs that, you know, was talking about how they built walking paths for their elders so that they could go out and walk. And they found out they didn't have a walking problem. They had a dog problem, because the dogs were attacking the elders as they were walking along the paths. So they had to go out and address the dog problem before they could address the walking problem. So, you know, yeah, and different people are going to be pulled in for different situations. But that's the beauty of this program, is it's very flexible in that way. If something comes up, then you bring all the stakeholders together and say, okay, how do we address this? How do we take care of the situation? How do we get things moving forward in a positive way? Does that help? Anything else?
A lot of great questions coming out of today's session. And we thank you all for taking the time to listen and learn, and your willingness to go back to your communities and make a decision, an informed decision at that, to decide if this is a good fit for your community. We all know that there's a need, but you can't do it alone. As Dr. Gray pointed out, you need to have some support from the tribal leaders, the tribal community, not necessarily the school, but the school's a good starting point also. So make sure that you're not going out there to save it all on your own, but you have some support system built in to help you work on this together and train together and learn together so you can serve your Native communities better.
Dealing with that negative media attention and trying to know what the limits are as far as what you can and can't say, and putting out positive messages as far as what are things people can watch for in their kids to know if they need help. Things like that, that you can get out and make use of the media to get your message out rather than letting them use you to get their message out. Yeah. And I think it was early on in the chat, the person from California that was asking about half the tribes in California. I'd be happy to talk with that person back channel as far as how they might address some of that. Yeah, because we're talking about over 100 tribes, I would guess is half the tribes in California. That I think is a little big for one of the programs in this project, but I think there's some things that we can suggest that may be helpful.
So Dr. Gray, that was Deborah. And I don't know if you want to put your email address in the chat box for her so that she can maybe address this with you. Again, if y'all have questions after today's event about signing up, how to do the application, or if you have questions about the application and time commitment, know that you'll be getting this entire presentation sent to you via email along with the survey. And I put the survey code in the chat box a couple of different times for each of you to please take the time. Remember, it is confidential and cannot be linked directly back to you, but it helps us with our programming so that we can ensure continued services like this for future events. So we thank you for taking the time to be here and listen to this important issue and how we can help our Native communities. Teresa and Megan, do you have any last words you'd like to share before we sign off for today?
I just want to say thank you for hosting and collaborating with each other on this. It's been informative to say the least, because as you know, we've done this before, so I'm very interested to see how it comes together again. So thank you very much.
Yeah, I would second that. And I'm just sitting here listening to you talk, Jackie, and there is a need in our Native communities for this. Even right here, there's absolutely that need. So I thank you for all the information and for doing this for us. Much appreciated.
My pleasure. I'm excited about this. Can you tell?
Repeat that.
Jackie, did you say something?
I said I get excited about this. Can you tell?
Not really. I'm actually getting excited hearing you, and my head's spinning about other ways we could do this. I mean, this is needed. It really is.
Well, again, thank you all. Thank you, Dr. Gray, for taking the time to spend with us and share your expertise. Thank you, Teresa and Megan, for co-sponsoring this event and this initiative. It's important for us to address these issues across Indian country. And we thank you to all the participants for joining us. We'd like to leave you in a good way and say thank you and have a good afternoon.
Thanks, Allison.
Thank you, Jackie.
Thanks, Jackie.
Thanks, Allison.
Teresa.
See you guys. Have a great day, guys. Thanks for being here.